A virtual greeting to everyone who has joined today on today's webinar on evidence-based medicine and research perspective, organized by GAIMS in association with WebMedQuest and Squad Medicine and Research. GAIMS, the Global Association of Indian Medical Students, which is a conglomerate of medical students whose shared vision. Everyone. Hello.
Yeah, we can hear you, madam.
Yeah.
Surabhi, you are audible.
Okay, sir. Global Association of Indian Medical Students, which is a conglomerate of medical students whose shared vision is to serve as a catalyst for the global emergent issues pertaining to them and ensure their active participation. RASO is the Research Administration Society of GIMS, whose vision is to promote and nurture the research knowledge, skills, abilities among medical students and making them aware of the world of frontline research, thus paving their way for their future entry in the world of translational medicine. The motto of our James Talk series is to disseminate thoughts which are idea-focused and on a wide range of subjects, to foster learning and inspiration, to initiate conversations that do matter for medical students. Aligning with the same principle, today's webinar is an hour-long event on evidence-based medicine and its research perspective. EBM, in the words of Dr. David Sackett, one of its founders, is a systemic approach to clinical problem solving which allows the integration of the best available research evidence with clinical expertise and patient values. As Dr. Kerry Graf once said, it is not a one-fit-all, but a personalized diet based on preferences and needs. It is a very bad day for me when I realize all I have been doing is perpetuating my patient to be sick instead of making them healthy. We are honored to have our guest speaker for the day, Dr. Rakesh Garg, sir, who is a prolific physician and a clinician par excellence. He is an anesthesiologist, in pain and palliative medicine physician. He has done his fellowship in evidence-based medicine and research methodology. He has also got his fellowship in palliative medicine from Institute of Palliative Medicine. He is currently serving as the Associate Professor at Department of Oncoanesthesiology, Intensive Care, Pain and Palliative Medicine at Dr. B.R. Ambedkar Institute, Rotary Cancer Hospital, AIIMS, New Delhi. He has completed his graduation from UCMS Delhi and did his specialization in anesthesiology from MAMC. He got his further training from AIIMS New Delhi. He has over 260 national and international publications to his name and has authored more than 20 chapters. He has delivered over 100 guest lectures and panel discussions at various national and international conferences, CMEs, workshops. He has guided many in ATLS, BCLS, ACLS courses, among others. He is serving as editors, editorial board members, and reviewers for various national and international journals, including British Journal of Medicine and Medical Research and Journal of Anesthesiology, among others. Sir, we are extremely honored and privileged to have you with us today. Attendees, please note that all the queries that you have regarding the webinar shall be cleared after the session ends. You can put them in the chat box. Now I request our honorable guest speaker of the day to begin today's session.
Thank you, Surabhi, for a wonderful introduction. I think more than I expected. Thank you so much. And thank you, the GAIMS, who is working wonderfully for doing various activities with regards to just not awareness, but dissemination of knowledge at the undergraduate level, because I personally feel that nurturing somebody at the initial stage is always good. If the seedling of a tree or a seedling is good, then obviously it becomes a nice plant. So I just give my best wishes to all the undergraduate students that you are the pillars, you are the future of medical sciences. And in case if I could help you a little bit, it would be my pleasure. Thank you for the kind invite. And if you permit, can I start now?
Definitely, sir.
Thank you.
Thank you.
So I think we'll be taking next around 50 minutes or so with regards to the evidence-based medicine and the research perspective. When we say, as Surabhi has also mentioned, that what it means by evidence-based medicine, it is very clearly defined as conscious, explicit, and judicious use of current best evidence in making decisions about the care of an individual patient. And this is the essence of medical care now. Medical care is not on the whims and fancies of an individual person. It is by his experience based on some underlying knowledge that will come into picture when somebody is being treated by a trained physician. It helps in integrating certain aspects. It's just not the literature, but integrates the clinical expertise of a clinician with best available external clinical evidence from various research. And that research needs to be compiled into a systematic way so that some meaningful conclusion can be deciphered from that literature. The practice of EBM it's a buzzword nowadays. Everybody says that they are following evidence-based medicine, and it has two fundamental principles. One is the expertise that comes with experience when you start seeing the patients, and it is also in association with the evidence as well. So evidence is not alone, expertise is not alone, but a combination of two allows us to make good clinical decision so that the patient becomes outcome. The second aspect of EBM is the hierarchy of evidence. When we say evidence, evidence is anything. A simple case report is also like an evidence, but the level of evidence is very low. So we need to look for the soundness of evidence and the strength of inferences that can be drawn from these evidences, which is reported in the literature. So that becomes equally essential. And this is pyramid, I think I usually discuss many times, because when you say a single case report or a single animal research, it is not sufficient enough to translate into your clinical practice on human beings. So this is how the level of evidence emerges. So when somebody do some research, it is on animal research, then they publish case series, then case control studies, cohort studies, and then come up with something called a randomized control trial. I'll be putting some words about it today in the subsequent slides. And this is essential because it gives the level of evidence much higher than what other I have mentioned earlier. Then when you combine those randomized control trials, you do a systematic review and meta-analysis, and that gives you a highest level of evidence. So this means when we talk of evidence-based medicine, the evidence is being deciphered from various options. But you need to see that what is the level of evidence, and accordingly, based on your clinical expertise, you can decide that what would be the best management strategy for a patient. Now, coming to the research, when we say research in our practice, which will be good for you to understand, the research could be a primary research or a secondary research. When we say a primary research, which are the actual scientific studies that are intended to answer some specific question. Secondary research is when somebody has already performed and published a study, and we want a comprehensive review of them to make some meaningful outcome. It becomes a secondary research. Now, the primary research is one of the important aspects to begin with when we take. So these primary research could be a basic research, which many of you must be doing at undergraduate level. Then comes the clinical research and the epidemiological research. When we say the basic research could be theoretical or applied, and it is based on the objective that you want to look for. It could be development physics, it could be analytical, it could be imaging procedure, it could be biometric, and so on and so forth. But we talk of the applied basic research, it could be based on animal studies, it could be cellular levels, genetic level, biochemistry, or material development. So these are the basic research, and they becomes a very important core aspect to subsequently translate into clinical research, because then we know that this is something happening at cellular level, this is something happening at genetic level, and that then we can translate into a clinical research, which could be experimental or observational. Experimental means you are just doing some interventions, some the change of modalities for management, and then looking for its impact. So it becomes a clinical study. But in case you are not doing intervention, you are just observing for the parameters for whatever is going on, they becomes an observational study. And observation can be with regards to therapy or diagnostic modalities or anything else. So these are called observational studies. For the epidemiological study, it could be experimental and observation. If you intervene something, for example, if you go to the outside the hospital and you look for the impact of sensitization for smoking in a group and the other group, and then want to compare, it becomes an interventional study. But if you just want to observe that how much people in the society are smoking, how much they are getting disease like cardiovascular disease or cancers, it becomes an observational study, which could be a cohort study or a case control. I'll come up with these type of studies in subsequent slide. So this is how we summarize the primary research. And when we try to collate all those into a single study, which has been published earlier into the form of a systematic review, it becomes a secondary research. And if you try doing meta-analysis, means whatever the data has been published from an individual research, we try to collate every data from various published research, it becomes a meta-analysis. Now, coming to the study design, whenever you want to do a research, the study design is important because we want to answer one research question. So when you want to answer a research question, you have to develop some methodology and you have to choose some study design. So I just mentioned you various designs. So each study design will be suitable for a particular type of research question. So the understanding of study designs and your research question is very, very important so that you plan a study which answer a research question that you want to answer. So it all depends upon ethics, logistics, economy, scientific thoroughness, and appropriate study designs ensure the validity of your results. So that's why understanding this becomes important, that which study design would be suitable for answering a question that you have raised from your review of literature. Clinical trial best establishes the causal relationship between exposure and outcome. If you want to see that if some interventions, for example, smoking causes cancer, there has to be some clinical trial, some observational, or maybe you need to follow up. So that needs to be done so that you know that something is related to other. Some is a risk factor for a particular disease. So that's why you have to choose an appropriate study design. Let's see some terminology which will be very useful for you when you plan some particular study, because you'll be sometimes seeing cohort study, cross-sectional studies, surveys, and so on and so forth. So let's understand what they actually mean so that we can choose an appropriate study design that will be sufficient and that will be able to answer your research question. Now, the first thing is when we talk about a study, we put a nomenclature based on the direction of a study. Now, when we say the direction, if the direction is a single point of time, you are not looking for some data or some findings in past or future, these studies are become cross-sectional. So you go out in the field and look for how many patients are suffering with disease, what are their exposure relationship, and all that, so on and so forth. This becomes a cross-sectional study. But in case if you go backward and look for whether the disease present is related to some exposure in the past, or there is something which you want to relate in the past, it becomes a retrospective study. But if you involve your patients and you follow them in the future, it becomes a prospective study. But sometimes we do an omnidirectional, we recruit a patient and then we look for some parameters in the past and then continue follow-up in the future, it becomes an omnidirectional study. So when you do a study, you need to define whether it is a retrospective study or a prospective study or an omnidirectional study. For example, let's see this study wherein which is looking for the factors affecting the length of stay in a palliative care center. Now they have just seen that what were the factors when the patient were admitted from the records, right? So they identify retrospectively from the patient records in the hospital with the patient and they try to find out. So it becomes a retrospective study because they have just looked for what has happened to a patient in the past which were admitted in a palliative care center. But in case if you look this study where they want to evaluate the effect of red blood transfusion on routine provision of palliative care, herein they were looking for transfusion of blood and its subsequent impact prospectively, that how it is helping the patient to resolution of the symptoms. So this means patient is being followed up after the red blood cell transfusion, the blood transfusion. This means it becomes a prospective study. So this is how the direction decide that which type of study you want to do. Now, the second study I mentioned, the primary research, it was the cross-sectional study. Now, herein, when we say cross-sectional study, the subjects are selected from the study at any point of time, right? there is no direction about it. And then you look for that how many patients have an outcome or how patient does not have outcome. For example, if you want to look for whether smoking causes lung cancer, so at any point of time, you'll go in the field, you look all the patients and they say smoking, and then you look for whether they have cancer or they do not have cancer. So this becomes a cross-sectional study. Sometimes we do it to look for the burden of the disease or some factors that is responsible for causing a disease. So this question, what is actually happening at any point of time, so that you can find some correlation, some no relation between the exposure and the outcome, and then you can do some study. For example, let's see this study. they, Here the researchers want to know that what is the preferred place of care and death in a terminal patients with lung and heart disease compared to cancer patients. So they just look for around 354 eligible patients, and then they look for that what concerns they have or what choices they have in the terminal illness, and that evaluation becomes a cross-sectional study. Ambidirectional means, for example, you have something which is being followed in the past, you introduce some new technique and you want to see its effect. So you want to compare the older technique with the newer technique, then it becomes an ambidirectional study. And the outcome, for example, in this could be the impact on counseling on analgesic requirements for patients who are managed for pain without counseling, with counseling. So you can just have in the past, your strategy of managing was not including counseling, but now you have included counseling in your clinical practice. So you can compare these patients in both the directions and look for the response that whether they have some impact on the counseling. Now, when we say a case control study is what happened to a patient who presented today with some outcome, right? So this is what we are looking for. So you have cases, you have controls, and then you go back and look for whether there was some exposure versus non-exposure that had led to case. So in this means you are going back. The direction of the study is going backwards retrospectively, and you compare cases and controls to look for what happened. What was the status that has led to the disease in today's time? So this is what is case control study. So for example, you want to see the methadone and corrected QT prolongation in pain and palliative care second. So they have compared two groups and they just followed, they went back and they try to analyze that what has caused them the disease. And that's why this becomes a case control study. Now, cohort studies, cohort is what will happen if some exposure is given to a patient. So this is, you select a cohort in a group, in a society, a village, houses in some way, and then you start following them. There will be a people who will be exposed. There will be people who will not be exposed. So it will be subjects and controls, and then you look for a particular outcome. For example, you want to look for that, go in a society and look for that, will alcoholism leads to pancreatitis? In follow-up, you do not know. So you just go and then keep them follow up and look for that. There will be some alcoholics, there will be some non-alcoholics. You will look for pancreatitis in both the groups, and then you will try to look for that if alcohol is continued, what will happen? If alcohol is not taken, what will happen? Will it cause pancreatitis? This means with outcome and without outcome, and that will decide you to make a decision that whether there is some relation or not. So these type of studies are called cohort study, and we do it in various situations. The one example I just show you. So this means these are this type of studies which we do. The other type of study which I mentioned in a primary research was an interventional study, wherein if you do interventions, it becomes an experimental study. But if you just observe, you just follow the standard of care, there is no specific intervention being done, it becomes an observational study. Observational study, if it has a comparison group, if it is absent, it's a descriptive study. If you want to compare two groups in a comparison, also in an observation, it becomes an analytical study. And then depending upon the direction of study, which I mentioned, whether you're going retrospective or prospective, you can divide them as cross-sectional study if measuring at one point of time. If you are going backwards, it becomes case control study. If you are going forwards, it becomes, as I mentioned earlier, a cohort study. So this is the nutshell, and then you can take a decision based on your research question that which will be a best study. In experimental, if you randomize it, it is randomized. If you don't randomize it, it's non-randomized clinical trial. So this is the basic infrastructure of various studies that you, for example, if you see off-label medication used in inpatient palliative care unit, where they look for 201 patients and they just observe that what will happen, the impact of various medications, it becomes observational study. Now, this is wherein the intervention was in the form of physiotherapy program to reduce the fatigue in cancer patients. It becomes interventional study. The experimental studies are always the gold standard because we want to analyze whether one intervention, maybe from the point of diagnosis, maybe from the point of curing a disease, whether they have some relation with the outcome. So these are the gold standard what we require. And the prospective study comparing the effect and value of one or more interventions against a control in human being or a human subjects with a medical condition is labeled as clinical trial, and we do it. The steps that you usually follow is this will be applicable across all the type of studies research you want to do. You draw up a protocol, you select a population in which you want to do. Out of those population, because you cannot research all the patients, you sample your populations. Those who are not fitting into your criteria, you exclude them. Then you can randomize them based on the type of study you want. You do an intervention, and then you follow up. So this is the basic infrastructure which we cannot bypass, and all the steps needs to be followed for looking for a definite outcome based on your primary objective. Now, first step for any research, for developing any evidence-based medicine practice, you need to do a review of literature and identify a research question. Now, review of literature is just not a very simple thing that you go into a Google, type some questions, you have hundreds of millions of articles, and then you say, I've done review of literature. It has to be done in some systematic way, in some focused way. And this is what will help you to have the whole research process. So this remains the first step of review of literature. Once you have a review of literature, you are aware of what the lacuna is there in the existing literature. You formulate a question and then select a research design, you collect the relevant data, you interpret the finding, you publish your findings, and this again becomes a future review of literature for subsequent studies. So this is how the whole research process is. And the first step remains a review of literature. Review of literature means is a written summary of journal articles, usually, but sometimes from other documents, so that you have a fair idea that what is the current state of awareness or information to that particular topic which you are thinking of. And it can be from various sources. So you have to identify the problem, that why are you doing for review of literature? For example, say I want to know that what is the awareness of research or evidence-based medicine among the undergraduate students. This may be my research question. So I need to look for the literature. And this literature, I can look for many sources. It could be based on my experience, my professional practice, my personal experience, by other factors. So I can look for. So when we do a review of literature, just think from what you want to review, why you want to review, and which are the places from where you want to review. So this will help you to understand and make a focused review of literature. Now, what you want to review is, this all depends upon your experience. So the extensive survey of all available past studies relevant to the field of investigation or the field or the research question that you are thinking of. So it gives us knowledge about what others have done it and what is the lacuna which you can further look for and do a research. Why you want to do it? Because sometimes we may not be aware that this is actually happening, or we may not be aware of a side effect. We may not be aware of a better modality of management. So that's why you need to do a review of literature. So you know that these are already existing studies. These are the concepts. These are the tests which has been done. And these are the limitations of a study. These are the variables that you need to define. These are the population in which you study. So these are the various things that you need to review so that you can make a purposeful research question, which can be further translated in the form of a research. So this means the purpose of review is to identify appropriate methodology, design of the study, including procedures employed, and data gathering instruments that can be used. For example, if you want to look for a distress scale, so you will do a review of literature, look for that how much is the distress among public during the COVID time. So this means if you want to look for distress, you want to have some objective scale. If you want to have some parameter. So that's why you do a review of literature, that which is the best tool best assessment parameter that can be done for assessing distress among the common man, among the layman, among the COVID patients during the COVID-19. So that's why this review of literature would be required. From where to do it? We have various electronic databases. That's a important source, a reliable source, and that needs to be done. How much? As extensive as you can. It all depends upon your research questions. There is nothing set number, so it has to be depending upon that what is your research question. So depends upon what is the time frame, but it would be reasonable if you can look for last 5 to 10 years, because that will give you sufficient idea that if there are some important articles before that, you can go ahead and do it. But the last 10 research articles, last 10 years research articles will give you a fair idea that what is the existent knowledge with regards to the research question that you have thought of. So when you do a literature review or literature search, these are the 5 points that you need to remember to make a good overview of your research. So you identify the key terms. So for example, I want to look for what is the distress among public in COVID-19. So when you do a research, you will not be typing the whole sentence. So you need to use a key terms. Now these key terms are known as that are the basic important terms which you need to feed into the electronic databases, and then they will give you some research. So the sentence I said about the COVID, so this means distress is one keyword, COVID is one keyword. So these are the two important keywords in that, and that is you need to identify. You may not be putting many other aspects because they will give you extra articles which will not be of a concern to you. Locate a literature through electronic databases, critically evaluate them, organize them into some format that these are RCTs, these are observational studies, these are case reports, and then you summarize them into a literature. So this is how we do it. Let's see some example here. I will just take you some on screenshots of real-time search. For example, you want to compare two drugs, drug A and drug B, and you want to give it intrathecally. I mean, for say, we give it for anesthesia purpose intrathecally, and you want to look for the effect. So how to do it? So this is one of the electronic database, which is called as PubMed. So when you put those keywords here, you'll be able to identify the existing literature which has been published in keyword. So I mentioned the keywords was subarachnoid, right? So this will give you certain articles. You can see enormous number of articles, 33,896. So these are very well. So we don't want all articles which are for subarachnoid anesthesia. We want that they should be very focused. So if you use this type of search engines, you find that you can reduce your number of cases, number of publications according to your research question. And these are the filters that you can use them. So when you add something more to it, for example, you want just to see clinical trials. So you can see out of 33,000, only 358 are clinical trial with full text. This means now it's easy. You can go around for 358 patients. But again, you don't want to look for all the articles with subarachnoid. You want to look for only subarachnoid which have used clonidine. So it has further reduced to 75. But then we want to use two drugs compare, it has further reduced to 5. So this means it's not easy to do a review of literature with non-specific keywords, because it will give you a million of articles nowadays. So you have to focus it. And this is what I said, that you need to look for the keywords, right? Similarly, you can see in this PubMed where you can locate the full text, because you'll be required for writing a review literature. Here, if you go in the summary part, you can see what you want to look for. You can just see the summary, and then when you see a summary, you will be able to see the articles according to dates. Also, I mentioned last 5 to 10 years are more relevant. So you can categorize them so that you can easily identify them. If you want to look for the details in the abstracts, you can open up the abstracts and can find them. Now, I said that the keywords. Now, this is the website from where you can identify. For example, you have written a paragraph and you're not very well aware that which are the good keywords for further research. So just write a paragraph and you can use this website, which can help you. So I just showed you this website. This is again from the PubMed, the MESH website. And when you open this website, you will find this type of words where you can look for that which are the appropriate keywords. Even if you don't know, if you have written a paragraph, you do not know that which are the keywords, you can just open this website, which is called Mesh on Demand, and you paste your paragraph into this box, right? So when you paste in this box, for example, I've written this paragraph, I do not know which are the keywords here. So I just copy this and paste it here in this box here. And then I click find mesh terms. So the moment I click it, it will give you certain words. You can see, and you see here, these have given me certain almost 13 keywords here. So these are the called as mesh keywords. So this will be helping you to identify the articles appropriately. The other search engines could be the Cochrane library, where you can go around and look for the review of literature. You can identify the articles. Similarly, you can use the Medline, you can use Ambase. So these are the search engines. So having said that, we know we have done the review of literature now. Now we need to identify that what are the aims and objectives. Why have we done that review of literature, and then formulate a research question. So the research question is one of the very important aspects for the whole process, and that's why we need to think of it, and we need to turn a clinical problem into a research question. So when you come up, you go to your clinics, you find that you are doing this, patient is not responding well. Why? Can we do something? And then you go back, review of literature, you find something, it's not very clear. Now this becomes a research question. So it started from a clinical problem, but now it's a research question, and that you can translate into clinical study. So this means the research question will be from previous research. If you read the articles, there will be somewhere in the last paragraph, they will say that this needs further research, this needs further evaluation, whether this side effect is actually related to the intervention. So this is how previous research will give you idea, new ideas or technology, your clinical own observation. Sometimes when you teach and learn from each other, you find that there is some clinical lacuna that needs to be further studied, and then you can go ahead and do a research question. Now, why a research question? Because unless we have a research question, we cannot proceed further on. We cannot just move vaguely. It will help you to make a protocol writing. It will help you to choose an appropriate study design, and then a methodology, and then further its publication. So this is what is very, very important, that if you want to answer a clinical problem, a good research question is important. And usually nowadays we want just one research question. So don't put in a single study multiple research question that we want to identify this, and from a single study. So these are not usually good. So it will be good if you put primary research question as one. And maybe if you think they are very, very important, you can put the other research question. But how do we know that this research question is good for us? So this is something called as finer criteria, which will help you to design a good research question. Finer means feasibility, interesting, novel, ethical, and relevant. So this is the mnemonic that stands by finer. Feasibility means you can do it. Interesting means it is good for the community, for the researcher. Novel means it is giving you something new information. It should be ethical. And relevant, this means it will help the patient management in a better way. So the research questions that you develop should fit into the finer criteria, and you can take it forward. Once you have identified that this is my research question based on finer, you have to put into words, and this words will be PICOT. So these PICOT should be there into a research question. So I cannot say I want to look for the effect of zinc on diarrhea. So this is a very non-specific research question. So the PICOT, I will just explain you what PICOT means, and that should be a part of a research question. So this means a research question, or maybe your aims and objective, the statement should have all those components. The study population, the intervention to be tested, the control arm intervention, the outcome, and the timing of measurement of outcome. So when you describe a research question, when you describe your aims and objectives, ensure that these 5 components should be there in your research question. Patient means whether you are taking infants, adults, elderly patients, male or female, type of surgery, type of intervention. So this becomes the population. Intervention means you are comparing 2 drugs, you are comparing 2 techniques, you are comparing some other modality of management. So it becomes intervention. You want to compare something with control, because only if you compare with some control, then you only can say that this intervention is better, equal, or inferior. So you need to have control, and that control could be a standard of care, or it could be a gold standard, ideally a gold standard. Then outcome. Outcome should be in some measurable form. So it may be qualitative or quantitative, but it should be in a measurable form. For example, the blood pressure, the heart rate, the complications, and so on and so forth, or maybe pain and anything. So these parameters should be mentioned, and the time frame. At what point are you going to measure the parameters that was just described, right? So this is what we need to develop the research question into a PICOT format so that you can take a good decision for selection of a study design and then subsequent publication in a better format. Now, this research question can be of any type. It could be for intervention, it could be for therapy, it could be for prognosis or diagnosis or etiology. It all depends upon what you want to study. So let's see this one. This is one research question I have framed. In adult patients undergoing elective surgery, does treatment with epidural analgesia in combination with acetaminophen and NSAID compared with epidural alone lead to better pain relief and less side effects over 24 hours following surgery? Let's see whether this fits into FINER and PICOT criteria. I've just highlighted these things. If you see here, now this is my population P. This is my intervention, which is in green. This is my comparison, epidural alone. This is my outcome, pain relief. And this is the time frame. So this is the complete research question that you should write before performing the research, right? And this is already fitting into FINER criteria. It's feasible, it's interesting for my clinical practice. It is a new study. There is no ethical issues and it's relevant to my clinical study. So this is how you can do for it. And similarly, the aims and objectives need also to be clarified based on your research question. It could be a primary or a secondary research question. Primary questions which is of greatest interest, which you really found. But if there are some associated objectives also, you can put them into a secondary objective. But don't try to put very great number of objectives here. Usually we say one primary or maybe 2 to 3, not more than 2 to 3 secondary objectives should be put for your study. So whenever you put objectives, you should follow the SMART criteria. They should be specific, they should be measurable, attainable, relevant, and time frame. So this will help you to understand whether your study is doable or not. So you should follow this SMART criteria for selecting your objectives appropriately so that study becomes good. The primary outcome, the endpoint should also be clinically meaningful, because if you do some analgesic to a patient, there should be some outcome that patient gets a pain relief. So the output or the endpoint should be meaningful, it should be measurable, and it should be sensitive to the effect of treatment. And this is what determines at times the sample size also. Now let's see this statement here, primary outcomes. It should be, I said it should be descriptive. Now, for example, if you want to see the effect of epidural block after LSCS, our primary outcome variable is pain. It may not be full objective. It should be written in a proper format, right? So it should be our primary outcome variable is pain as measured by visual analog scale on a scale of 1 to 100. So that's your outcome should be properly defined when you plan a study, right? So when we say the objectives, again, it should be very clearly, I mentioned here, right? So it should not be something like this. They do determine the impact of preGAM in patients undergoing abdominal surgery. This is not correct. So what you need to do is you need to have detail of everything. How much dose, at what time, in what patients, and what are going your outcome. So this is how you need to describe these outcomes. So having said that, just to summarize the key points for having a research question and objectives, you need to follow these good mnemonics of SMART, FINER, and PICOT. Once you have done it, you need to create hypothesis, right? Hypothesis means that whatever you thought that your research question is and your expected outcome is, you are going to test through this hypothesis, and it drives the study design and the study objectives, right? So for example, the zinc supplementation infects bone small for gestational age, reduce mortality. So this may not be appropriate because it is not giving you whole information. Again, you have to include the PICOT into this as well, so that your what I said earlier, a research question or your objective or a hypothesis have a full information. So you have to mention the population, the intervention in totality, the control, that is a placebo, and outcome is the mortality that needs to be looked for. So having said that, we have started with our clinical problem, translated into a research question. We defined our aims and objectives on the background of a good review of literature. We have looked for a study design. Now put it in the form of a protocol so that we can do it. So this is what is called as methodology. It should be a detailed strategy so that you are able to prove your hypothesis and is replicable. First is the selection of study design. which I mentioned in the earlier. Depending upon the research question you can think of. If you think you want to look for some intervention, it has to be RCT. If you just want to look for the effect of something on the patient population, it could be cross-sectional, because if you want to see the distress among the patients or among the population because of COVID, it could be cross-sectional. But if you want to look those patients who were admitted with COVID, what have the impact? So it will be retrospective. So it depends upon the research question. You can have selection of study. You need to define your study area, that where you'll be doing it. It is hospital based, it is community based, it is OPD based. So you need to define them. The study period should also define. For example, nowadays we are doing a lot of COVID studies. So when you do a COVID study, the management or the drug therapy is changing because the evidence is coming up. So if you do a study, you should define that the study was done between March and April of 2020, because at that time the treatment for COVID was a little different. In September, it is something different. So if somebody knows, yes, in March they have done this study, then it's okay. So that's why your study period should be defined. The participants or the subjects for your study, they should also be defined into your study protocol. So you need to have inclusion and exclusion criteria, that how you try to include into a study, whether you will exclude certain patients, or whether there should be a criteria that if somebody is included in a study, whether somebody will be excluded from analysis or you discontinue your intervention. So this whole details should be there in your method protocol once you plan your study. For planning, there should be a planning for data collection. How will you collect data? Who will collect data? Where will you keep your data? How will you enter into a data sheet? How will you remove the errors there? So this whole planning should be there in the method section. If you want to use some measurement tools, you need to define. For example, you want to look for the pain in a patient who sustains trauma. So the pain management tools are many. It could be visual analog scale, it could be numerical rating scale, it will be just mild, moderate, severe, it could be pain, yes or no. So there are many tools. So you need to define those tools so that if you use different tools, the outcome may not be comparable. So choose those tools, define them, and train the person who will be using them so that they can use them appropriately. And you can create and perform where you can measure all those things. Now, this slide is again very important when you plan a method section of your protocol, that whatever observations you are collecting, they should be defined. How, when, and where. How means I just mentioned that how are you going to measure the pain? How are you going to measure the blood pressure? Are you going to use an automated blood pressure machine? Or are you going to a mercury-based BP measurement? Or are you going to do an invasive blood pressure monitoring? So you need to define them, because all the three will give different readings and you cannot use any of them at the discretion. So you need to define when. So you should be mentioning that when the BP will be measured, in a sitting position, in a supine position, at what point of time. So it should be defined. And where. So again, these things should be very clear in a method section, that whatever you are going to do, whether it will be a home-based or hospital-based, patient will be coming to the hospital for BP measurement. So all those things, all those details must be there in your method section. And obviously, the ethical clearance and all those approvals needs to be taken with great confidentiality to the patient records. So once we have done it, we have a method section. We should also be very clear about the sampling, that the best research would be that you include all the patients across the world, do an intervention and see it. But this is neither ethical and not doable. So this means we need to sample some of them, and then can say that in this sample, I found this beneficial effect, and then generalize into the other whole world. So this is what you need to define: the target population, the study population, and from those you need to do a study sampling. And then you can do something called randomization, which include allocation concealment also. This is important because if you just divide arbitrarily into two groups, you can create bias. One group can have more sicker patients, the other group may have less sicker patients. One group can have younger, the other can have elderly. So when you are comparing two groups with two different demographic profile or baseline data, then they are not comparable and you will not be able to have meaningful result. That's why we do randomization and allocation concealment, and its description, that how are you going to do it, who will do it, how will you maintain the concealment of the randomized groups needs to be defined into your study. And once you have done it, you also need to think of the statistics. That's again very important, because the interpretation of the difference, because if you study 200 patients, you will have some data, yes or no, this is the age for. So looking for the data in an Excel sheet or a data sheet of 200 patients will not give you any conclusion. That's why you have to apply statistical tool, so that you can summarize your data and can make some meaningful conclusion out of it. And that's why you need to include people who are expertise into statistical method, and they can test your hypothesis using some statistical tool and give you some outcome of it. We also need to understand our variables that we'll be using for this. We usually say they are qualitative or quantitative, because the statistical tool will be based on which type of parameters are using, which type of variables are you using. So that's why this chart is very important. So we'll be discussing sometime in detail when we plan some studies like this. But then you need to be clear. For example, the gender is a nominal qualitative data. On the other hand, age is a continuous numerical data. On the other hand, the number of patients admitted, they are qualitative, but they are discrete. So that's why we need to understand that whatever we are observing, whatever parameters we are observing from the study, they are which type of data, because they will be helping us to do a statistical analysis too. So once you have done it, I've just showed you my last slide, how the manuscript is sent for publication. So once I said, you plan a study, you do a study, you have already done it the way I've just mentioned, follow the norms, correct the data, do analysis, and then you need to send for publication. So this is just an overview that how when you do a study and send it for publication, how it go about. So you decide, you write a manuscript paper, you decide a journal, it is sent to a particular submitted journal. Nowadays, most of them are online journals. The chief editor or the associate editor looks after them. And then whether it is appropriate or not, depending upon it, it is reviewed by editors. They can send you back for some technical modification, or they can send it for peer review. The peer review is usually blind. They see your articles who are expertise into that particular specialty. They review, they put up their comments, and based on this, the editor takes a decision whether it requires revision or whether it can be published. So based on this, the editor takes 4 decisions, whether they reject it, or they ask you to revise it, or they accept it, depending upon the article. And based on this, a final decision. If they ask you to revise it, you see for the reviewer's remarks, correct or revise your manuscript, and then submit it again for a possible acceptance. And this is how the thing goes on. This is my research group Facebook page. We have many good like-minded persons. So if you have some basic queries, you can join this research methodology and publication group, wherein many of the people will be able to give you basic solution, and some of the interesting articles are also uploaded time to time. So this will help you to understand some of the basic nitty-gritties of research in your clinical practice. So this is in brief about the research. And then when you start doing this research, you go back and the data becomes the evidence. When you collate those evidences, it becomes an evidence-based medicine with clinical expertise of the physician, which is integrated. And then you are able to practice in a more evidence-based practice that is being followed for the day. So this is from my side to summarize, and I'll be more than happy to have any questions from anybody of you.
Thank you so much, sir. All of us are indeed enlightened, and I'm definitely sure that everybody who is joining us during this webinar was extremely benefited. So we do have some questions that we would like you to answer. So the first question is, what do we mean by staging system and clinical system, and how is it helpful?
This is with regard to what? Staging system and clinical system for what? It is for clinical practice?
Yes, sir.
See, so when we say, I mean, this is a little non-specific. Somebody, whosoever is asked this question, if you can elaborate further on that, what actually he is looking for, then it will be easy for me to explain it further. If you are talking about the management system, so it all depends upon the disease status, disease stage if they are looking for. Then again, it is based on the evidence that we generate. So based on this, for example, so the people have done, say, 50 studies for something, and they have studied that particular disease, and they found that this is the management plan for it. And then based on this, it comes in evidence based that if a patient is having this much of blood pressure, this is the management point. If patient has this much of blood pressure, this becomes the management. So this means we are grading, or we are categorizing the patient's management, clinical management, based on the evidence that is suitable for that particular patient. So this is how we can do evidence-based medicine. And usually for this, based on the existing evidence, something, if you remember, I mentioned the RCTs, then it was systematic review and meta-analysis. And then the systematic review and meta-analysis are used for formulation of guidelines. And these guidelines then categorizes the management tool for clinical practice.
Thank you, sir. So the next question is, what are the drawbacks of ambidirectional study?
There is nothing called drawback of any particular study. It all depends upon the research question that you have developed. And according to it, you have to choose your study design. So there's nothing called a bad study design or a good study design. It all depends upon research question. But what we can talk of is the limitation of those studies. So when we say the ambidirectional study, this means some of the data we are collecting retrospectively and some of the data we are collecting prospectively. So when we collect data prospectively, the chances of bias are much less. For example, we want to ask a patient about certain clinical factors. For example, how much is your pain today? So patient knows it, patient memory is there. So he will say my today pain is this much, right? It is mild, it's a numerical rating scale of 4. But if I ask somebody, how much was the pain 2 months back or 1 year back, he may not be able to remember it, right? So this means we are creating an interview bias into it, right? Similarly, when we do prospectively, I know that in my study, I need this 10 parameters to be recorded. And this is the tool to be used. For example, if I needed, for example, blood pressure monitoring for a patient prospectively, then I will define that I will be using a non-invasive automated blood pressure, which automatically measures the blood pressure, right? So I know it, so I will be using this tool. But if I go retrospectively, I do not know whether somebody has measured that blood pressure using a sphygmomanometer or an Android manometer or an invasive blood pressure monitor. So this means the data of blood pressure is variable. When the machine being used is variable, the outcome or the data that I am collected will be different. So those may not be comparable. So that becomes a limitation of a retrospective study. So when we want to compare retrospective data with prospective data, so this means I can never compare orange with an apple, right? I should be comparing research apple with apple, right? In prospective, somebody has made a BP measurement using one tool, but in retrospective with some other. So in ambispective study or ambidirectional study, they may not be comparable. So these becomes a limitation of this ambidirectional study. That's why the prospective studies are weighted on the higher level of evidence. And that's why their weightage is much more.
Thank you, sir. So the next question that we do have is, what is the significant difference between case control study and retrospective cohort? Could you elaborate which is better and why?
Say, I say again that if you ask me an empirical question that which is better, so all studies are based on a particular research question. So that I mentioned that you plan a research question with your aims and then choose that your research question will be answered by this study design. So this is how we can say. We cannot say that I've chosen a retrospective study and then I'll go for a research question and say I will be able to answer it. No. So you need to plan research question. For example, say I want to look for a rare disease, like for example, say, let's talk of the COVID-19 today now, right? So I do not know if say COVID-19 has something, say after 1 year, somebody has rarer symptoms, like this impact, whether COVID-19 causes cancers or not, right? So there may be hardly a couple of patients, a rare disease. So when it's a rare disease, you cannot do a no prospective studies because it will take hundreds of years for getting an outcome. So I go back and then do a study. If I just want to know that COVID-19 is causing some disease or not, or some other impact on the body. So I will just see for whole records who are in follow-up of the patient and see all the COVID patients who had history. I'll see the records and see whether he has COVID-19 or not, and then look for why he has come to the hospital, right? So in this, if you go back, this would be a retrospective study where I'm just looking for all admitted patients. But I want to compare something, right? I want to compare something because if some disease is there, it's a rare disease. I could not do a prospective study, but I want to compare with some other group. So I will choose this group as a case, and I will match this with a similar patient profile with either no disease or other disease, right? And then I will just analyze all them. It becomes a case control study. So this is usually done for a rarer studies where you don't have many patients, like genetic disease, like Treacher-Collins syndrome, patients with some metabolic disorder. So they're not very common. You cannot do a prospective study. That's why you do a case control study for these patients. But if the disease is very common, right, you can do an intervention. I want to look for whether the remdesivir is better or flavipir is better, right, in COVID-19 patients. So I can do a prospective study. So I need not to go for a case control study that on the last 6 months, who has received this one and this one. So that may not be giving me a good remark. But if there are no studies published, right, I just want to look for whether there is some reason for doing it. So when I mentioned review of literature, you go back and see and compare whether there was some effect or not. If yes, you confirm from a prospective randomized control trial. So this is how you can choose a study design based on your research question, based on your review of literature, and accordingly you have to do a study design. So this is not vice versa. This is based on a research question and then choosing a study design for answering that particular research question.
Thank you, sir. So the next question is, for analysis, there are several validated scales, for example, for analyzing a study population. So how as a student do we select the best scale and assess the best knowledge available in our research study?
So this is a very, very important question you have asked, Surbhi. The literature is filled with many parameters, many scales. So you have used the term validated scale. So again, when I was mentioning that why review of literature, right? So why review of literature, you have to look for many things. So when I say, for example, I want to look for distress among COVID-19 patients, right? So since this is a new disease, so I don't have data, but I can say distress among an acute disease, right? Any respiratory disease. So I go on the literature search and I will do a review of literature and I will put my keywords, right? Keywords, validated scale or score, distress, COVID-19. So it will give me something, right? Then out of those, I will go into those articles and see whether the scale is suitable for my population, which I've selected in my method section. And based on this, I can take a decision whether this scale has been validated into prospective studies, right? So what we do is how these scales are prepared is, so people try to gather the data, they try to categorize them into certain figures or some categories, and then they prospectively follow them up onto a population and then say whether the scale which they have developed is true to their whatever intensity or severity or a disease process, whether they are matching or not, and they compare with gold standard. This is what is called validation. So this is again based on review of literature. You look at which are the scales available. Now, if there are more than one scale, right, then you need to look for, because when you look at scale, they will just mention that this scale is applicable for assessment in this group of patients, right? So based on the research question, which I said PICOT, you look for that PICOT and look that that PICOT is for which particular scale, right? And if they are matching, so this means that validated scale or score is suitable for your population and you can use it in your study. So again, in summary, the selection of a scale should be a validated scale. If there are more than one, you need to look for which fits into a research question. And based on this, you can choose your appropriate scale. But again, this is absolutely based on review of literature, or sometimes with our personal experience, I know, because we are working in this specialty for last so many years. So I know that for pain management, visual analog scale is one of the best one. Descriptive, brief pain questionnaire or McGill questionnaire, pain questionnaire is one of the best scale. So I do not do a review of literature because I know it by virtue of my experience. But if a novice is, even if somebody says, and no, sir, you are not speaking true, VAS is not the correct scale, I want to do a review of literature. If you do a review of literature, you will know that the VAS is the good pain scale for pain management. So again, this is based on review of literature.
Thank you, sir. So being so vast, the next question is, being so vast and with regular updates, how can one ensure that they gather the right evidence from the ones available and apply them in their clinical practice, especially undergraduates like us?
Right. I think you have asked a very, very important question. So this is again important because if you see Google, Google is something like a full of garbage. You do not know. You just put it the treatment of COVID-19 and you will get millions of articles, and you do not know that which is the correct article to follow. And if you start practicing it, you will be following the norm things, because there will be articles which are very good. There will be articles which are not to the proper standards. There are certain publications in Google which are not been reviewed by anybody, and people have just put their personal opinions to it. So this means whenever you read an evidence, you should see the, I have described the method section for you. So just see that who has conducted that study, whether it has been peer reviewed, whether there are basic components of doing a study being done in that particular study, whether they have thought of inclusion exclusion criteria, whether they have blinding, whether they have done randomization, allocation concealment, whether they have applied appropriate statistical tool. So this means they need to understand, even for a clinician who wants to read the publication for its clinical management, must be aware of research. Then only can say that this research published appears to be acceptable to me. So this is called critical appraisal of a published literature. So whosoever wants to learn about things, just do a review of literature, how to critically appraise a published paper. So they are just simple steps to look for it, which I have included into my session also. If those steps are there, this means the study is good. If they are applicable to your patient profile, you can translate into your clinical practice. But if you do not know really that whether they have been done, then follow the standard guidelines of some professional body, because then you know that this is a big professional body. For example, say Indian Society of Anesthesiologists is a big professional body. If it releases some guidelines, this means they are authenticated. They have been peer reviewed, right? And it has been made by experts, and then you can accept that. So this is two ways of following the evidence into your clinical practice. But simultaneously, remember, many things comes with experience. So you need to have experience into management of that particular case also. And that's why when you go into clinics, initially in the initial period, you are attached to some senior so that they can guide you and help you. That these are two evidence, but for this patient, this evidence is better. So this management protocol will be better for this patient. So this is how we can decide. Otherwise, there is a vast sea of literature available, and choosing them into a small span of time sometimes it's difficult. So that's why learning from seniors is also equally important.
So our next question is an interesting one. Someone has asked, what is your views on the need for physician scientists, and why do we need them?
Sorry, can you just repeat your question?
So what is the need for physician scientists, and why do we need them?
Now, if you talk of India is a little different from the Western culture. Here, the clinician itself do the various research. But if you remember one slide, I mentioned somewhere a basic research and a clinical research, right? So there is a lot of work. So it all depends upon that who wants to do it. Now there is a combination of basic and clinical research. Even in the clinical aspect, people do molecular studies and look for its clinical translation value. So that's it. When you do a research along with the clinical practice, you need a lot of time, right? Because you need to follow up a patient, you need to collect the data, you need to interview the patient, right? So there are so many things that needs to be looked for. So when you do a research, you need a team of people who will be doing those research, right? So there will be some person who will be a research fellows, some will be physician scientists there, some will be clinician, and then this team will be able to make a good decision from planning, from execution of a study, and then finally interpretation publication. And that's why these are various team members of the research team that helps you to make a good study with some meaningful outcome for its publication.
So the last question of the webinar is, sir, what are the key parts while writing an article or a manuscript? What is the thing that we need to focus upon?
Right. So I think this is one of the very important question when you want to publish an article, because if this key part is not included into your manuscript, it will be summarily rejected. Right? They will just send you back, or they will even reject it. So if you remember, I mentioned something into the method section, right? So all those components must be part of it. So if you talk of RCT, randomized control trial, the experimental studies. So the basic framework is an introduction, a method section, a result section, and then followed by a discussion, right? It is along with references, along with abstracts, keyword, and a good title. So these are the broad components of a manuscript, right? That must be there. But each broad component should be complete in itself. For example, let's talk of title. So when you talk of title should have all the keywords. So you can take help of PICOT, right? So title should have populations, title should have intervention, title should have control, title should have parameter, title should have time frame. So this should be the component and the type of study. So this means a title will be complete if we include all the basic keywords into this, right? Similarly, abstract will have its own composition. Keywords, I already mentioned in my mesh keywords. Then coming to introduction, it should have a focus objective, a hypothesis, a research question, what is the lacuna in the existing knowledge, and what you want to do, right? So this is the basic component. In the method section, I started from, in my slide, I showed the whole components. The approval has been taken. How will you select your population? What are your inclusion and exclusion criteria? Your method section, your intervention should be in detail. Your randomization, allocation, concealment, blinding should be in detail. Who will do a blinding? How will you do a blinding? So they all should be mentioned there. How data will be collected? Who will collect the data? What monitors, scales, tools, machines will be used for monitoring those parameters? How the parameter will be recorded, who will be recording it, and how they will be summarized using statistical tool. And then these whole details must be there in your method section. And then whatever results you do it from analysis should be in details and then discussion accordingly. So these are the key components of your manuscript that must be there. Maybe sometime later, GAIMS can arrange a separate webinar for how to write a manuscript, right? Because again, this will be a 45-minute session that how to write a good manuscript for possible publication. But whatever the components today I have discussed, they must be a part of your manuscript because they are essential. So you cannot miss them. And once you've written it, we can discuss in detail what do you mean by a good manuscript for its submission. So that will give you a good manuscript for possible publication in a good journal.
Thank you, sir. It was an enlightening experience. I hope everybody who was a part of this webinar enjoyed it and learned a lot from it and will apply it in their clinical practice or whenever they go ahead.
Right. So my best wishes to everybody. I hope I was able to summarize it, though we conduct a research workshop, which goes for whole full 1 day, wherein we discuss usually one type of study. So I think we can discuss it sometime, but it is in association with some group discussion, some interaction, some hands-on practice also. So that will empower you. But I think GAIMS, to my knowledge, has created a research group. Surbhi is leading it, I think.
No, sir.
No.
Tarun
is leading it. So Tarun can take, Tarun is already taking some initiative. I think gradually, if you start doing a small study initially, you can learn its nitty-gritties, and then subsequently you can add on to learn new things that will make you more mature. And many of you undergraduates get some short-term fellowship or short-term training for research also, and some funding also. So everybody can use it. So I'll be more than happy to help you out to do small studies at your hospital. You can do it, and then it will create you more confidence and learning exposure as well. So thank you, and thanks once again to all the GAIMS team.
Thank you so much, sir.
Thank you so much. Yes, sir. Yeah, sir, Sobham sir, we can end the meeting. I mean, live streaming service.
Arun, are you saying something to me?
And another, sir, like I am saying to Subham sir, like we can end the live stream in YouTube.
Your voice is, I guess, breaking. Hello? Your voice is breaking. We are not able to clearly hear it.
Yeah, yeah, okay. Live streaming service we can stop, I am saying, in YouTube.